Sounds good.
Okay, great. So welcome everyone. So for those of us who celebrate Lunar New Year, it was Tuesday, 2 days ago here. So happy Lunar New Year, year of the fire horse. That's what they say. So I'm hoping that, this year is going to be um, a little better than 2025. To start us off today, we have one of my former colleagues and mentees, Dr. Awirut Oon-arom. So he's going to be sharing his journey and his experience as a GloCal fellow and what he did after. And I have a very brief intro. So Dr. Awirut Oon-arom is an assistant professor of psychiatry at the Department of Psychiatry, Chiang Mai University. So his research focuses on global mental health, LGBTQ plus health, and social cultural determinants of psychiatric outcomes in Southeast Asia. His work spans mental health among gender diverse populations, sexualized alcohol and substance use, and other community interventions. He integrates clinical psychiatry, epidemiology, and culturally responsive approaches to advance equitable mental health research and education. It's been awesome getting to know Awirud. He got to spend time at UCLA, and we're gonna be going to Chiang Mai in August, so hopefully
Oh,
we get to see you there.
um, I will be there for sure, Jay, and welcome back to Chiang Mai again. And
Okay,
thank you.
great.
I'm very honored that for the introduction, and I'm very honored to be here today. So I was a GloCal Fellow since 2022 and 2023. So at that time, it is the start of the ending of the COVID pandemic. So I try to make myself more opportunities to expand my research experience, especially in like the Western world, because mostly I work in my country and around this area. So that's why I think I need to bring all of the data, all of the experience to exchange with other people, and thankfully I got Dr. Sungjae to be my mentor at that time, Dr. Sherry Larkins, and Dr. David Relati from UCSD. Okay, so I will start with the background with the land acknowledgement. I would like to acknowledge the land that I
So Awirud,
each
just
each.
yeah, just real quick, the screen says you have started screen sharing, but I don't see
Oh,
any slides. I don't know if other
oh,
colleagues can
okay,
see it.
okay.
Julie, can
So I
you
was
see his slides or?
uh,
We can't see them. No.
Okay, yeah, it's just a black screen and it says you have
just
started.
black skin.
Yeah, you have
Okay.
started screen
It
sharing.
said it said that my screen sharing is paused. So
Oh,
let me try sharing it again.
okay. Sorry about that.
That's okay.
There you go. Okay.
Okay.
Yeah, we
Okay.
see the land acknowledgement. Okay, great.
Okay. Thank you, Jay. Thank you,
Mhm.
Jay. So I respectfully acknowledge that we are on the traditional lands of the ancient kingdoms of Lana that we call the ancient name of Chiang Mai, which is the northern of Thailand, with the land of generosity and empathy. And firstly, I would like to start with the current career that I have right now. So, as Jay has mentioned already, that my research area would cover the global mental health, LGBT plus mental health, suicidality, substance use, and culturally responsive psychiatry. So at that time that I was a GloCal fellow, I did the project um, called Sexualized Drug Use Among Men Who Have Sex with Men and the HIV PrEP care continuum in Thailand, because at that time, mostly I work with the LGBTQ community. And I noticed that one of the big issue would be the substance use with the sexual health risk and sexual health behavior. So in Thailand, actually, we have a lot of problems. The first challenging um, the first challenging situation would be the substance use and suicide are the main cause that they lost their disability adjusted life year. Um, the most problematic substance would include alcohol and amphetamines, and the co-occurrence of the disorder would include depression and schizophrenia, um, which causing more chronic um, course of the disorder. When they happen with the substance use, the course of the disorder, like schizophrenia and depression, would be longer than it should be. So the second challenging problem in Thailand would be we have fewer choices of pharmacological intervention for the people who have the problematic substance use. At that time, we don't have the naltrexone, which is the first line treatment for the alcohol use disorder, and we have no the buprenorphine and naloxone, which would be the main thing and standard treatment for opioid use disorder. So I just need to find out, are there any other options that could be the potential treatment that available in Thailand for the people who suffer from substance use disorder. And the third challenging at that time would be the new trends in addiction problems. So at that time, because I engaged with the LGBTQ community from the community clinic, so I noticed that the practice of chemsex, the practice of sexualized alcohol use, and the legalization of cannabis and using cannabis with sexual behavior would be the main thing that we should concern at that time. That's why I developed the proposal of sexualized alcohol and sexualized drug use, correlated it with the PrEP, HIV PrEP use in Thailand, because at that time, PrEP would be the new thing for the HIV prevention in Thailand as well. We have only some community clinic, even in the university hospital. We have only some department that can prescribe PrEP for the people who would like to use HIV preventive intervention. That's why the research was started. So at the beginning, I engaged with a lot of collaborations, including the research Institute of Health Science from Chiang Mai University. I try to communicate with M Plus Clinic. M Plus Clinic is one of the community clinic for HIV preventive interventions. And we try to explore whether it is possible to include the participants from M
Goodbye.
Plus Clinic.
Okay. What was that? What is that?
Okay. And the last clinic that I tried to not involve, actually, I established with the team in Chiang Mai University would be the CMU Pride Clinic, because we consider the challenging situation with the trans people because we have limited services in Thailand. So we try to establish the clinic for trans people and take care of their mental health during the trans process. We include the doctor from gynecology, surgery, internal medicine, endocrinology, and growth developmental pediatricians. So we try to cooperate with many departments in Thailand. And finally, after I got the great opportunity from GloCal, we have started the research about sexualized drug use and sexualized alcohol use with the visiting of Dr. Somjeli and Dr. David Grelati with the Dean of the Faculty of Medicine. Um, okay, so how I built my research identity from local to global. Because mostly I may, because at the time in my department, there is some um how to say it, like the need to develop more subspecialties in my department. So they need someone who take care of the part of the addiction psychiatry because at the time we don't have anyone to take care of this part. So I'm interested in this part because the challenging situation that I explained earlier. So after that, after I got the good opportunity from GloCal, it was I think this opportunity to open the research world and widen my experiences to engage with differences area, which I will mention in the next part. And I think this opportunity introduced me to the next opportunity in Canada as well, because at that time I tried to find some places that I can collaborate with, and finally one um, mental health research laboratory contact me and offer me to be the fellow in the next 12 months in Toronto, Canada, at the Center of Addiction and Mental Health. So I was in the translational lab in Canada. So another 12 months would be very excited part because it would be my first long time period outside Thailand, and it's the new field of the research because mostly in the GloCal program I working with the like epidemiologists. I studied the epidemiology and I studied the intervention, like mobile health intervention, how to apply it in the community. So it would be more kind of global health and public health. But another 12 months, I expanded my research area to be in more preclinical study and brain imaging study. So it's kind of totally different from like different areas of research, but both opportunity creates the unique integrated research characteristic that I will bring it back to Chiang Mai University and the area around in Thailand and around Thailand as well. So I would say every area would be very important and it can be connected if you find some key population or um, the key findings that we could apply for the next level. For example, there is some genetic studies for addictions. So I may try to find a way to connect it with the from the behavior to the genetics findings as well in the future. So it's kind of mixed together of the public health and preclinical studies. Okay, so from the beginning of GloCal fellow, I need to study more in public health, in sociology and gender studies. I try to connect it with the key persons who targeted the population and include the participants for me, for the team, I mean. And I need to study more about the biostatistics and epidemiology. So I try to mix everything together. I brought the data that I have in transgender population, in MSM population, and medical students with gender diversity to apply with the knowledge that I gain more from GloCal, including the clinical work in addiction psychiatry, mixed method studies, clinical research, translational research, and syndemics frameworks of the HIV. At that time, I think syndemics framework would be the main thing that I can study more, and I think it's quite new concept for Thai researcher at that time. Maybe I think there is only one or two teams in the university in Bangkok that work on the syndemics framework of HIV infections in Thailand. So it's quite new for Chiang Mai University as well. So I try to introduce this concept to the team in Chiang Mai too. Okay. Um, During the time that I conducted the research, there is two main challenging when I need to work across cultures. So for Thai people, um, the one of the challenging thing would be they are aware of the risk that they might violate the law. For example, they use illegal substances. So they sometimes concern that disclosing the history of substance use might be a problem for them in the future. So I and my team, as the researchers, must clearly communicate the confidentiality protections and the data anonymization procedures to them. Because mostly Thai people would not, I think people all over the world would not, they don't want themselves to have problems with the illegal things, but they did it sometimes. So they're just aware of opening their information. Another issue for Thai people, because mostly um, I would not say all of the Thai people be like this, but some of them, especially the people who have gender minorities, and they might experience some kind of minority stress or discrimination previously. They are at the beginning, they are quite close. I mean, they're not open that much to about the details of the using substances, about sexual life, about sexual behaviors, or the behaviors related to activities. For example, using the apps like hookup applications in their sexual life, something like that. So the issue would be very intimacy, and um, they are concerned about disclosing this. So the interviewing in the qualitative research, we need to explain more about the process, about the information that we will keep it to be confidential and would not release it to other ones. Because I did the research only in Chiang Mai, and there is a quote for Chiang Mai people that okay, Chiang Mai is very small, and even when they give the information, it will be connected with other people that the doctor, I mean myself, will know someone in the circle, something like that, because we have very small circle in Chiang Mai, so they are aware of this a lot. So this is the big challenging for me, and working in the interdisciplinary team at that time. I think mostly it's going quite well because I'm working in the same environmental that I worked before. But for you guys that you work in the US mostly, and you're traveling to collect the data or interview the people here in Thailand. So I think the language would be the first thing that we should concern. And the second would be the ethical considerations or legal considerations that I mentioned earlier. Okay. So after that, in terms of the institutional collaboration networks, um, during the time that I was in GloCal, I got a good opportunity to be in um, the member of Neurology Collaborative Science Group, or Neuro CSG, of Advancing Clinical Therapeutics Globally for HIV and AIDS, or ACTG. I was selected as a member from 2023 to 2025, and I will be starting like collaborating a new project on pramipexole with um, depression and cognitive impairments in people who living with HIV. Nearly, I think, during in this middle of 2026, we can start the project again. We I think there is some changes about the funding, so we delay for around a year. So we hope that we can start in the next 6 months around. Mm. Other than the experiences in with GloCal. After that, like I mentioned earlier, I got an opportunity to be in Toronto. So in Translational Addiction Research Lab, I have many projects that I involve. And in terms of clinical work, I work in the concurrent outpatient medical and psychosocial addiction support services, or COMPASS, for around 1 year. And around 3 months, the last 3 months, I engage with HQ services, which is very good model of working with the sexualized substance users or with the sexual behaviors that related to addiction. So I try to gather all the information, gather all the process or the service system to be applied in Thailand. So this is the global knowledge that I got from GloCal and then from CAMH in Canada. Other than collecting all the knowledge and integrating the knowledge in LA and in Canada, I distribute our work in many settings. The first oral presentation was in the 2023 National Transgender Health Summit in San Francisco. I was presenting greater psychosocial syndemics related to worse quality of life among Thai trans women. So I brought the data to analyze with the syndemics framework and from GloCal, from the mentor from GloCal who introduced this concept for me. And then we presented in the Transgender Health Summit. And the research project with GloCal, I presented at CPDD once. It was the preliminary study, and the final project was presented in NIDA International Forum in Montreal, Quebec. And another project with CAMH I presented in the CPDD 2024. Okay, after I got gaining experience from at least two centers, two big centers who is very keen on like addictions, behaviors, and like the concept of public health. I try to continue it in Thailand. So like I mentioned earlier, I try to start the studies related to cognitive impairment and MDD. And I try to continue the project collaboration with CAMH about the capacity building in HIV, chemsex, and addiction care in Thailand. And I also have some friends during the time that I was in Canada who worked with the gender laboratory. They try to start the project to interview the child with gender diversity and try to figure out what is the mechanisms of being like transgender in children. So it is another project that we start in Thailand as well. Okay. Other than the networking in like outside Thailand, during the time that I'm doing the research fellow with GloCal and in Canada, I try to cooperate with other universities in Thailand as well. We have the LGBTQ related research alliance with Chulalongkorn University, Sirirat, Hospital Mahidol University, Khon University, Songkhla, which is the central and local university in Thailand to start our project together in medical students. And we also have the LANA Alliance for Addiction Research and Behavior, which aims to create multi-center studies on addiction psychiatry. But mostly the center are in Chiang Mai. So I aim to get more centers to involve in this network in Thailand to get more participants in the project that we aim to start in the next 2 years. Here is the series of the mental health in LGBTQ medical students. We analyze about sexual behaviors, depression, anxiety, religiosity, academic difficulties, and what they need for medical schools as well. So if you are interested, you can search in these keywords and maybe including my name to see how we work together and how we collaborate, how we analyze them and present it to the committee of medical students in Thailand. Okay, for the balancing professional and personal life, I would say during the time that I was in GloCal fellowship, I meet a lot of people. I try to follow my mentors, Dr. Sherry, to anywhere she would be and engage with the team at the international ISAP. And with the team, I think it would be a good chance to connect with the people and I would say I would travel a lot during the time that I was in LA, but it is because when I need to go back to Thailand, there are a lot of tasks that I need to do it together at the same time. As a lecturer, as a researcher, as a healthcare providers. So as I show it, the list of the things that I have to do in Thailand is very um, full scheduled, occupied. So during the time that I was in LA and I was in Toronto, I try to balancing my personal life maybe more than um, the time that not more than like equally to the time that I spend for work. So I would say sometime the project is still finished um, on time and finally we get published just last year for the project of GloCal. And because during the time that I was in the GloCal Fellow, I still have the role of being mentor as well. So my challenging situations would be I need to be mentee and mentor at the same time. So I have at least 4 or 5 students, 4 residents in psychiatry, and 1 master students in mental health. At the same time that I need to do my project. That's why it's kind of like it's a good way to transfer the knowledge from my mentor, like international mentor, to be like to be to my students in Thailand. So in a good way, there are many possibilities and there are many um, knowledge that I can transfer. But in a bad way, I would say, not bad way, like challenging way, I need to manage my time to be with my project and to be with my mentees project as well because they need more guide because they don't have any um, basic research skills. So sometimes we just need to encourage them to learn at some point, some important point, and then try to supervise them for the next step during the time that I need to do my work. So it's kind of like messing up sometimes, but finally, all of the research project is went well. Is going well, and some of my uh, mentees they are getting published for their research work. Okay, so in the future opportunity, because for now I don't, I still, it still be the plan to apply for the NIH grant. So what I'm looking for the opportunity in the future, I'm not quite sure would that be a good mechanisms that I should apply for example, the R21 or RO1 for NIMH, which is quite challenging, but I may need to ask Jay whether this aim would be possible for me in the future. But other than the international grants, I try to apply with the national grants in Thailand as well. And I got two national grants from Center of Addiction Studies in Thailand and from the Center of Affective Disorders in Thailand. So it is a good beginning for me to get some grants, national grants, and in the future, I think it would be a good profile to secure the international grants like NIH grants. So that's all that I would aim for. This is still the plan, but if you guys have any comments or any questions, or Jay, if you would like to make a comment or anything for the plan, and if there is some points that I need to explain more, please kindly give me the suggestion. And thank
Yeah.
you for your time.
Yeah, Awirut, thank you for sharing